I'm Jacqueline Ostrom. I'm a semi-retired consultant. I work for Seattle Children's Hospital, but before that I was at Carol Milgard Breast Center for 8 years, had my own philanthropy consulting business. In 2010, I started working at Carol Milgard Breast Center. At that time, we realized we didn't really have epidemiology that supported where should our best efforts be. And so we commissioned through the board of directors an epidemiology study in 2011 which showed that African American women in Pierce County bear the highest burden of breast cancer and also tend to have more difficult breast cancers that are harder to treat. We began to create discussion groups throughout Pierce County. So we worked within 12 churches and we interviewed just under 80 African American women to talk with them about this finding and also to understand from them what was on their mind. Why were they showing up for mammograms? If not, why? What were some of their concerns? We wrapped that up. We made a report back to the board of directors at the Milgard Center, and a bunch of women raised their hand and said, we want to keep working on this issue and we want to keep working on addressing health disparities in Pierce County. That was the genesis of Leaders in Women's Health. Early on, we also realized that financial constraints were a real problem for many women. Many women were putting off a mammogram, or if they had a mammogram, they would be putting off their care. One of the key reasons that we want to focus on this work is that we know that women can die from breast disease if it's not caught early enough. So we know that when you take a woman from the home, you're really removing the heart and soul of that family, and it's very difficult, not just for African American women, but for all of our community. So we began to work on this idea of financial consulting where women could come in, they wouldn't have to worry about the cost of the mammogram. We would work with our partners and we would find a way so that these women would not have to worry about the financial repercussions of their care. And so Leaders in Women's Health kind of became the engine for outreach. So we began to look for and recruit, at that time we called them community health workers. Now I think they're really more breast health navigators. These were trusted members already established in the community. They would reach out to friends and family and engage them in talking about mammograms. They would work with us in the churches to share in terms of workshops and health fairs to get the word out.
My name is Adrienne Tillman, and I am a nurse working with the Leaders in Women's Health as their navigator for the Sister Friends program. I did participate in the survey and the data gathering. I didn't like the results, plus seeing breast cancer occurrence in family, friends, and patients, I decided that was my passion. I would like to do what I could do to help prevent that.
Hi, I'm Miss Deborah Thomas. Back in December of 2021, then I had a mammogram. They said you need to come in to just get another picture. My own doctor couldn't get me in. I met Adrienne Tillman. So I called her and I said, Adrienne, pray for me and I got to get all this. And she said, let me see what I could do. So the next thing they know that they got me moved up. After that, I'm retired and I said, then Adrienne said, Deborah, you should come join. So now I'm a Sister Friends navigator.
Leaders in Women's Health is all about women helping each other. It's about listening in community to what community needs and then mobilizing and getting the resources and leveraging those resources for better health in community.